Hello everyone, welcome back to our study of mind rubrics, and today we shall be studying the rubric blood cannot look at, or a knife, right? So blood, this is the technical definition. Now I did not feel that there is a requirement to have dictionary meanings for such a rubric, but just to maintain the uniformity in the manner which we make our rubrics, I've just written a copied a technical definition of blood from the internet. So, what is blood? Blood is the red liquid that circulates in the arteries and veins of humans and other vertebrate animals, carrying oxygen to and carbon dioxide from the tissues of the blood. But I don't think we are talking about this meaning in this rubric. What we are talking about in this rubric is blood which signifies violence or which signifies bloodshed. When you see bloodshed, when you see somebody losing blood, somebody either due to an injury or due to a surgery or due to some kind of violence happening and someone bleeding, that this patient cannot tolerate, that he cannot take it. That's why it's not just blood that is written there. Blood and knife, they cannot look at blood or knife, so that's why it is bloodshed, something that has to do with violence and bloodshed. So something that's cutting, something that's injuring, something that is mm, causing pain and suffering and violence, that they cannot see. Mm. And when they see something like that, then they have symptoms, then they start experiencing intense palpitations, trembling, sweating, fear, panic, or they faint. Some kind of symptoms start to develop when they look at at blood or knife or violence. They can't see that. So what is the remedy in this rubric? There's only one remedy that mm, Dr. Kent gives in his repertory, and that is alumina. Hmm. Now, interestingly, I had a case of a 9-10 year old boy who had convulsions. Hmm. And he was put on anti-epileptic medicines, and his EEG did show some activity, and also there was a small scar tissue when his MRI of the brain was done. CT or MRI, I don't exactly remember. So what happened is the parents felt that he's just a 8-9 year old boy. For how many years will we be giving him anti-epileptic remedies? What should we be doing? How can we get remedies? How can we treat it so that he is not on medications? So that is when they chose to come to homeopathy, and they came to me. And the history was such that the father told that, um, see, doctor, everybody tells us that he has convulsions, all doctors tell us, but whatever I have observed is, when he gets hurt, or when he um, has any kind of pain, that is the time, no, we have seen that he develops something very strange. His body starts to move and he just faints and he just falls off. So then we were told, Are, this is convulsions. So then um, I don't understand, because otherwise, when things are normal, he does not develop any symptoms. He's absolutely normal. So what happens is, this child just comes over here. He stands over here, and I try to ask some questions and all such things, and suddenly the child says, um, "I don't like this calendar over here." I said, "Why? What happened to this calendar?" He said it's red in color. I said, wow, so what if it is red in color? No, I can't see red color. Why you can't see red color? No, I something happens to me. I faint. So for example, if I see blood, blood is also red. I can't see. I just faint. Or if I get hurt, more than hurt, if I get hurt and I start to bleed and I see my blood, oh, that's the time I get my convulsions. I can't see blood. I can't see, some kind of injury or pain. I can't see even others having that. Someone else bleeding also, I will fall down. I don't want to see. I just run to my house. Hmm? So this patient, I gave him the remedy Alumina, and now it's 3 years. He has not had a single convulsions in the last 3 years. He still comes to me irregularly, just to check in between, but because he was told you have to take more anti-epileptic medicines all your life, so the parents feel it's good to keep base with the doctor intermittently. But since we have given him Alumina for the last 3 years, he has not had a single convulsion. Most importantly, now he is able to see injury, he's able to see blood, and he does not faint. Hmm? So this is a very, very um, mm, classical and a clear-cut symptom of alumina, that they cannot see blood or they cannot see any kind of violence. And if they see those, they develop symptoms, whether in the form of fainting or convulsions, etc. So that is what we have for you, friends, with regards to this rubric. There are other rubrics which can be looked up as cross references for this rubric, which is fear of blood. Fear means, oh my god, I get scared to see blood. That scared, when the scary aspects predominate, then you take the rubric fear. When this patient is not telling I am scared, I cannot look and I faint. So you cannot see something and you develop symptoms. So that's when you think of this rubric. Fear, when the fear aspect predominates, then you use the rubric fear of blood. Hmm. So like that, we have to subtly differentiate rubrics. So, yeah, that's it, friend. A very small rubric, only one remedy, easy rubric, easy learning. So, I hope this rubric helps you in your practice. I look forward for your suggestions and opinions on the same. See you in the next rubric. Till then, bye bye.